Buddy, it's me. Get some more light on the subject here. So this is my annual Halloween post. As you can tell, I am ridiculously made up. I kind of look like Mimi from Drew Carey. I'm wearing my Halloween dress. I'm sorry, my Hawaiian dress with my lei with the, bra straps hanging out. Lee decided it would be fun to match me. So he had his Hawaiian shirt on that he bought, unbuttoned, hat on cockeyed. I had my camera on me, socks with flip flops, and he had his lei on too. So just so you know, I don't obviously go out this way ever. I'm really uncomfortable, obviously. I can't wait to get this crap off. But since I have always done a Halloween post because I love Halloween, here you go. I felt I needed to do a post anyway. I haven't really posted you on my health issues. I continue to have bowel issues, persistent diarrhea, to the point where I finally asked for a referral to GI because I can't function. It hit me one day at work last week. For some reason, I have started bleeding again with the depot. So of course I was wearing a pad and it caught whatever leaked. But I'm continuing to have leakage. So that's embarrassing. On top of that, the Provigil that I was given for my shift work disorder has stopped working. And I'm once again falling asleep in the middle of phone conversations, in the middle of work. People in the back that work with me in the chart room, if they know if I get too quiet, then they have to come check on me because chances are I'm passed out at my desk. This has happened on more than one occasion. Let's see. So I went to neurology on Monday, and I saw a new neurologist, and finally was vindicated in the fact that I was diagnosed with juvenile myoclonic epilepsy, or JME. JME is a type of epilepsy that usually presents itself in adolescence, meaning that the first time, well, actually, it will begin in adolescence, but usually kids and teenagers get enough sleep. Usually comes on when you're cramming for tests in college or what have you. Well, you don't sleep, and then lack of sleep is a true trigger, one of the more common triggers for JME. And so kids will end up having these seizures when they hit school. For me, puberty hit, whatever, I was subbing a paper route, didn't get a lot of sleep, and bam. My first set neurologist that I had, she decided that I would be fine without my medicine. I didn't have insurance, and she decided not to. They had samples, but she wouldn't help me out, so she took me off my meds. Within 8 months, I had a seizure. That was my last one, mind you, September 6th, 2009. It is now 2018. It has been over 9 years, and I'm still medicated. My old neurologist that I saw after her told me that usually when people with my type of epilepsy go this long without seizures, they'll take you off meds. I refused. I flat refused. So he didn't take me off. The neurologist I saw told me flat out, you can never stop treating JME. You take a person with JME off medication, and it's not a question of if they will seize. It's when. When will they have that seizure? And so I was vindicated in that because I refused to go off my medication for seizures. I am well controlled. I live a normal life, mostly. Seizures don't really get in the way. I also discovered that my migraines that I get are not, in fact, part of my seizure disorder. They're hereditary. My dad had migraines for his whole life. My sister has them. My aunt had them. And when I described the pulsing power surge sensation I was getting, that up until that point no one could tell me what they were, I was told finally what they are. It is called migraine invoked vertigo. It's not an inner ear thing, so you don't spin. It's like a pulsing sensation. Your brain, the blood vessels in your brain with a migraine contract. And so what's happening is they're not contracting hard enough to cause pain, but they're contracting to cause this pulse. You're feeling a hardcore pulse in your head. And they have many ways to treat it. The ultimate thing is, though, when I'm having an episode of that, I'm having a migraine. I may not be having pain, but I'm having a migraine. And because they're so common and they're persistent, they're day in and day out, that becomes a problem. So there are a couple of meds they can give me to treat. The problem is that I'm on so many medications already that it becomes a problem to prescribe. One, they can give me a Zoloft. Well, I already take Lexapro for my depression and I'm stable in that regard, so they don't want to mess with that. Two is Topamax. Topamax is another anticonvulsant. It's used to treat migraines, and it is very helpful in the treatment of migraine-invoked vertigo. Sorry, I still have the cough from when I was really sick. The problem with that is that I had a really bad reaction. It's why I switched to Depakote to Topamax. When I had the reaction, I switched back to Depakote. I stopped sweating. It's one of the lesser known reactions to Topamax, but I couldn't sweat, not even a drop. And so we don't want to do that. Plus, you can't give a person Topamax if they're taking Depakote. There's a very complicated weaning starting process. I've done it several times, and it's you can't give them together. They're not good together. It can be catastrophic. The other medication is propranolol. It's a beta blocker, but I already take atenolol, and my blood pressure is well controlled. So the only one he'd be willing to mess with at this point is the atenolol, because it's not quite as, you can kind of wean off one and start the other. But he wanted to try something different first. So he has got me started. I'm actually starting it tomorrow. CoQ10, magnesium, and B2. Those are the more holistic approaches. So we're going to try that, and we're going to try that for 2 months. On top of that, I was diagnosed with that my tendonitis that I'd always thought I had in my wrists, which I probably did in the beginning, has now gone straight into carpal tunnel. He did this test where he basically took a reflex hammer, hammered on my hand and on my wrist across the area where the carpal tunnel nerve is, and when he did it, my whole hand went like this, and I felt just electricity all the way through my hands. And he pretty much goes, yeah, no, you have carpal tunnel. Because I was explaining how my hands would go to sleep from my elbow to the tips of my fingers. So now at night, for the next 2 months, I have to sleep in these lovely braces. They would have me wear them all the time, except that it's both hands, and I can't function that way. The first night I wore them, I guess I beat up Lee. I'd roll over and smack him about the head and neck. But he doesn't think it's going to help. I've obviously had it for so long. I mean, I've had tendonitis, or what I thought was tendonitis, since I was in my early 20s, and I'm now 41. So it's been over 20 years that I've had it. And I don't know when it progressed from tendonitis to carpal tunnel, but they have to try the braces first before they can even get an EMG approved to check for nerve damage. Once the EMG is done, then we'll figure out what to go from there. I did convince my cardiologist to start me on Lasix. So I'm on Lasix and potassium every day. I lost 4 pounds in 4 days of water weight. So I'm just hoping that continues to help. I went and saw my psychiatrist yesterday, and I was explaining the situation. I had talked to Dr. Brar. She's one of our psychiatrists in our office, and I wanted to ask her, okay, here's my situation. And so she recommended that I bring up changing from Provigil to Vyvanse or Adderall. Those would help with both the falling asleep as well as the binge eating thing. So I brought that up, but I didn't bring up the binge eating thing because my psychiatrist doesn't really think that's a thing. There's no pill can fix that, she says. So I went in and I'm explaining the situation. I'm like, my stress level is becoming problematic. I'm now starting to have suicidal ideation because I feel trapped. I am a prisoner in my own body. I'm trying to, and so now she brings up the concept that I may not have sleep apnea, but there's this distinct possibility I could have a type of narcolepsy. That's great. So let's revise. So I have a positive ANA panel, potential lupus, or some other equally gnarly thing. I have some sort of weird bowel thing going on, so I have actually incontinence going on. I have migraines and migraine-invoked vertigo, so that's what the pulsing is. I have bilateral carpal tunnel syndrome, and now there's concern that I may have narcolepsy. Yeah, I'm in pain every day of my life. There's not a day that I'm not in pain. I'm afraid to leave my house. I have to scope out the bathrooms wherever I am. I can't, I can't function like this. So, I, she agreed to take me off for 2 weeks. She said that's all she could do because my stress is manifesting because of my physical health problems. As a result, she can't be the one to manage my leave. It has to be my primary care doctor. So I messaged my primary care doctor trying to explain to her, this is what my psychiatrist said, this is what she's concerned about, and she thinks I should be off through the diagnostic and diagnosis process. Her response was, and I shit you not, folks, I can't give you any more time off until we have a solid diagnosis. Okay, so I have a consult with GI for my intestinal issues on the 20th of November, 5 days after I go back to work, mind you. I have a fitting for orthotics tomorrow. I can't get into rheumatology until the 20th, and I don't, Lord knows when I'm going to have a sleep study to figure out if I have narcolepsy or not. And you're telling me you want me to go back to work while all this is up in the air and I can't function? What the hell? I just don't get it. So I messaged my neurologist. I said, look, this is my situation and you're my last ditch effort here. I can't work like this. I just can't. I need help. And I can't do the tests and I can't do the appointments and I can't do all these things because I don't have a PTO, because I've been too sick and I've been out a lot and I can't lose my job. I need help to maintain. At this point, it's about saving my job. My health has gotten to the point where I can't work. And I need to save my job so that when I am well, I can go back to it. But you're not, I don't get it. Does that make any sense to any of you? I'm not going to take you off work any longer until we get a solid diagnosis. Sorry you can't get in for 2 months to get that. What is wrong with her? Anyway, so I will start off today. I spent an hour on the phone with my employer because when I was off sick with pneumonia and bronchitis, was on a leave. And they said they never got my paperwork. So then, after I got that sorted out, I went and dropped EDD paperwork off at my psychiatrist because they don't do it online. I went off to the gym. I still have to do that. So I get back home and then I get the message from Dr. Gaeta, which just pissed me off. Anyway, so that's where we're at. I will keep you apprised. As of right now, I'm off until the 15th of November. I'm hoping that I can get some sort of help in the meantime. Now I'm off to wash this crap off my face because let me tell you, it is uncomfortable. All right, happy Halloween. Be safe. Blessed Samhain, and have a great one.